Okay, I believe all permissions for recording have been granted. If you requested permissions in the chat, you should now be able to record. If you still need permissions granted, please leave us another message in the chat. Dr. Vanderhoff, we'll hand it over to you now to begin today's press conference.
Well, good morning, and thank you for joining us today. I'm Dr. Bruce Vanderhoff, Director of the Ohio Department of Health. Before we get to our main topic today, a discussion of the 2023 Ohio Suicide Report, I want to provide an update on where we currently stand in Ohio with respiratory viruses. As expected, we have seen some shifts in disease activity, and we are in what almost every year are the peak months of respiratory season. Looking at COVID cases, we've seen them increasing starting in late November through a few weeks ago, although nowhere near the peaks that we've seen in the past. Over the past 2 weeks, though, cases have gone back down substantially from over 8,000 new cases the week ending January 2nd to around 5,500 cases the last Thursday measurement that we took. So while this is encouraging, sadly, we are still seeing an average of 26 deaths each week. Put another way, every week we are losing a classroom of Ohioans to COVID-19. This is why I have repeatedly said that COVID is something we need to continue to take seriously. If you've not received the updated vaccine, please consider doing so, especially if you are over the age of 65. It offers the best chance at protection against severe illness, as well as protecting others around you who may be more vulnerable to the disease. Meanwhile, we have experienced a significant rise in flu and RSV in Ohio over the past month. The CDC now rates flu activity in Ohio as very high, and hospitalizations for both flu and RSV are increasing. Again, this underlines the importance of taking simple preventative steps, such as frequent hand washing, covering your mouth when you cough, and staying away from others when you're sick. It also underlines the importance of getting vaccinated. If you have not yet received a flu vaccine, please consider doing so. Another virus that we're seeing increasingly in Ohio and nationally is norovirus. Norovirus is primarily spread from contaminated food, surfaces, and hands. People with norovirus can feel extremely sick and vomit or have diarrhea many times a day. And this can lead to dehydration, especially in young children, older adults, and people with other illnesses. Now, symptoms of dehydration include decreased urination, dry mouth and throat, feeling dizzy when you stand up, crying with few or no tears, and in children, unusual sleepiness or fussiness. Norovirus spreads very easily and very quickly, but you can take steps to protect yourself and others, and these include wash your hands well and often, cook shellfish thoroughly, and wash fruits and vegetables before you work with them or consume them. Clean and disinfect contaminated surfaces. Wash laundry in hot water, and stay home when you're sick for 2 days, that's 48 hours, after your symptoms first stop. And finally, back to the topic of respiratory illnesses, we have seen some positive trends that I'd like to report. I spoke last month about spikes in pertussis cases and outbreaks of Mycoplasma pneumoniae. Fortunately, both are on the decline in Ohio. Pertussis cases peaked in November and have been declining since. We did end 2024 with 1,725 reported cases. That's the most in Ohio since 2010, when we had 1,851. I'd like to mention that the Ohio Department of Health has an excellent resource, our Summary of Infectious Diseases dashboard. And that's a great place that you can go to look up case counts, historic trends, and demographics on more than 100 reportable illnesses, including those I just mentioned. And we'll post a link to that dashboard now. Now, another topic worth addressing here is highly pathogenic avian influenza, also known as bird flu. As most of you probably know, there has been an outbreak of bird flu worldwide over the past few years, mostly affecting wild birds, but also sometimes reaching commercial poultry farms or even backyard flocks. We have had several farms and flocks infected here in Ohio since the outbreak began in 2022. Fortunately, no human cases have occurred here in Ohio, and human cases remain rare and usually not severe. Nationally, the CDC has reported 67 cases in humans. The CDC considers the current risk of bird flu for the general public to be low. However, people with close and prolonged, unprotected contact with infected birds are at greater risk for themselves being infected. The best way to prevent bird flu is to avoid unprotected exposures to sick or dead animals or their environment. People should avoid direct contact with wild birds and observe them only from a distance if possible. Ohioans can report sick or dead wild birds to the Ohio Department of Natural Resources at 1-800-WILDLIFE and sick or dead poultry to the Ohio Department of Agriculture at 614-728-6220. If people do believe they've had an exposure, they should monitor themselves for any new respiratory illness symptoms. Persons who develop any illness symptoms after handling sick or dead birds or other animals should also contact their local health department and seek medical attention. People should generally not eat uncooked or undercooked animal products, including raw or unpasteurized milk or dairy products. Rest assured, however, that it is safe to eat properly handled and cooked poultry products and pasteurized dairy products. And of course, people should always wash their hands with soap and water after touching any animal, animal products, or an animal's environment. Now, let's turn to the Ohio Suicide Report, which the Ohio Department of Health publishes annually. We'll send out a news release with a link to that report shortly after this press conference. I am pleased to say that in 2023, for the first time in 3 years, deaths by suicide declined in Ohio. It was a slight decline, about 1%, but nevertheless, it is in contrast to an 8% increase the state experienced in 2021 and another 1% increase in 2022. We certainly hope this is the start of a trend. Nationally, the drop in deaths was less than 1%, so Ohio was a bit better than the nation as a whole. Before we go further, I want to say that every death by suicide is a tragedy that deeply affects so many. The fact that Ohio lost 1,777 individuals to suicide last year, or nearly 5 people every day, affirms that tragedy. This is a sobering fact, and it is why, even though we take some encouragement from this slight decline, we are committed to continuing to work hard to drive those numbers down further. Governor DeWine has made mental health a major focus of his administration, and the Ohio Department of Health, the Ohio Department of Mental Health and Addiction Services, and many of our sister agencies have collaborated to tackle this issue and reinforce the governor's priorities. To help us discuss the progress in Ohio, we are going to welcome in Director LeeAnne Cornyn, who directs the Ohio Department of Mental Health and Addiction Services. Director Cornyn, can you put this report into context for us? How much progress does this represent? I know the trend line, both nationally and in Ohio, has been unfavorable for several years. So how can we view this drop?
Well, as you said, after years of steady increases here in Ohio and also nationally, these findings that we're talking about today are absolutely a step in the right direction. And though these reductions are slight, I truly believe that this is evidence that all of our efforts as a state are beginning to make a difference. But as you said, there is still so much work that we have to do, so much work ahead of us, because we are losing nearly 5 Ohioans every single day. These are moms, dads, brothers, sisters, neighbors, coworkers. And all of these losses, as you stated, are truly a human tragedy. And they're a reminder that we have to do more. We at Ohio Moss know that the demand for services has never been greater. And that is why we are striving every single day to make sure that prevention, treatment, recovery supports, and crisis services are visible, accessible, and effective in every single Ohio community. Governor DeWine has truly committed himself to building the community mental health system that was promised in the Community Mental Health Act of 1963, but never fully realized. And we want all Ohioans to be well, get well, and stay well so that they can live up to their full God-given potential. Every single day, we're striving to make good on the governor's promise to build out that community system of care. But we're also partnering with local communities, with our sister agencies, with local coalitions, with businesses, and other nonprofits for the very first time in Ohio history to come together in a unified way to really address suicides in our communities. Under Governor DeWine's leadership, Ohio authored its very first suicide prevention plan in 2019. And last year, we issued as a state our second version of that suicide plan. Thanks to the governor's leadership through the Recovery Ohio initiative in partnership with the Ohio Suicide Prevention Foundation, we truly believe that having a single unified plan for all Ohioans to understand and find their work within is really beginning to make a difference. And we think that that's part of the reason, we hope that's part of the reason why we're beginning to see some of these reductions here in Ohio.
Director Cornyn, you've pointed to the fact that there's been a lot of structured work to address this very, very important issue conducted by your agency as well as other agencies across the state. Can you share with us a few examples of some of those programs?
Sure. Well, Governor DeWine has certainly been a gigantic champion to address suicide in all of our communities and has really challenged almost every single state agency to do their part to help ensure that we're getting one step closer to our goal of zero suicide here in the state of Ohio. One of our biggest efforts to address this is through our 988 Suicide and Crisis Lifeline. For those who may not be familiar, in July of 2022, Ohio launched this easy to remember 3-digit phone number that every single Ohioan, regardless of where they live, can use as a resource if they are contemplating suicide or have other mental health or behavioral health needs. It's 24/7, completely free and totally confidential to call. Ohio actually has the largest network of call centers with 19 call centers all across the state, ensuring that no matter where you are, you're reaching someone close to your very own community who understands the needs and resources that may exist in that community. Since we launched in July of 2022, we have fielded more than 440,000 contacts. That's calls, chats, and texts from Ohioans in all 88 counties. So we know that the need is there and we know that the demand is there. What's really great about Ohio's 988 system is that 99% of calls are answered right here in the state of Ohio. So this is truly Ohioans supporting one another to ensure that they have access to the resources they need to be well, get well, and stay well. That's our effort at the state level. But we're also trying to support local communities in designing interventions and programs that meet their local needs. We have developed several centers of excellence to help spread evidence-based programs that are designed to address suicide. And we're also supporting the expansion of local coalitions that are really the boots on the ground work at the local level, implementing these programs and ensuring that they're meeting their localized needs. But we also know that every single Ohioan plays a role in reducing suicides. And that's why we have also worked to equip thousands and thousands of Ohioans with the skills that they need to recognize mental illness or substance use disorder and have the skills that they need to talk to their peers, to talk to their family members, and help connect them to care. Through mental health first aid and programs like Question, Persuade, Refer, we are ensuring that all Ohioans have the skills that they need to support their friends and their neighbors and their family members.
Thank you very, very much, Director Cornyn. Well, as we wrap up today, I want to provide a few tips on how we can all stay safe in these bitterly cold temperatures. The biggest health risks in this weather are hypothermia and frostbite. When exposed to very cold temperatures, your body begins to lose heat faster than it can be produced. Eventually, this will use up your body's stored energy. The result is hypothermia, or abnormally low body temperature. Body temperature that is too low affects the brain, making the person unable to think clearly or move well. This makes hypothermia particularly dangerous because a person may not know it's happening and may not react promptly or appropriately. Now, some of the signs of hypothermia include shivering, exhaustion or feeling tired, confusion, fumbling of the hands, memory loss, slurred speech, and drowsiness. Frostbite can happen to an individual who has uncovered skin very quickly, within minutes. Some of the signs of frostbite include a white or gray-yellow tone to the skin area, skin that feels unusually firm or waxy, and numbness. If you notice signs of hypothermia or frostbite on yourself or someone else, get medical attention immediately. If immediate care is not possible, get the person to a warm room as quickly as you can and follow these guidelines. For hypothermia, remove any wet clothing. Try to dry the center of the person's body, neck, head, chest, and abdomen, and use warm drinks to help increase the person's body temperature. For frostbite, do not rub or massage the frostbitten area, nor walk on feet or toes that show signs of frostbite damage. This can actually increase the damage. Place the affected areas in warm water if it's available, or warm the areas using body heat. In both cases, medical attention is still very important. It's necessary as soon as possible. With that, I hope we can all stay warm and safe. And Ken, I think we are ready to take questions.
Okay, thank you, Dr. Vanderhoff. A reminder to please only ask one question. And our first question today comes from Judith Bird of Hannah News Service.
Good morning.
You there, Judith? All right, we can come back to you here. Their next question will be from Samantha Hendrickson, the Columbus Dispatch.
Good morning.
Good morning. I have a question about the Trump administration's decision to halt CDC communication, especially in light of all these respiratory illnesses that we're seeing and the uptick there. How will this impact the way that ODH communicates with Ohioans about these kinds of illnesses and data? Especially, I feel like multiple times in these press conferences, we talk about CDC recommendations, right? And things that the CDC and information has put out about there. So how might this change the way that ODH communicates with people and how they're getting their best information to keep Ohioans healthy?
Well, the Ohio Department of Health is, of course, a state entity. And so our communications are not affected. In fact, we're having a press conference right now But beyond that, I really can't comment further.
Okay, our next question is from Deba Uwadie, New Americans Magazine.
Hello.
Thank you. Good morning, Doctor.
Good morning.
What is the demography of the deaths from COVID in recent months? You said about 25 every week. How do we classify them? Age, race, and the demography?
Very good. So yeah, we have a lot of very good information about COVID-19 as well as other conditions. Much of that information is available on our website, and I would point you to that. We shared a link there, I think earlier, and Ken, I'm sure you can share information about how folks can get to our various dashboards. So I'd ask you to turn there first. If you have further questions from a data point of view that are not being addressed there, you could feel free to follow up with Ken or other folks in our communications department, and they'll work to get you what you need.
Thank you.
You're welcome.
Yeah, our next question comes from Sarah Donaldson, State House News Service.
Hey there, Dr. Vanderhoff. Thanks for having this
Hi.
today. Can everyone hear me okay?
Just fine.
Perfect. So in talking with mental health advocates in late 2024, Tony Coder with the Ohio Suicide Prevention Foundation told me just that this next budget cycle is going to be rough for social services because we've seen coronavirus money completely dry up. Could you or LeeAnne speak to how the state continues a trend like this when we may see social services get fewer funds in 2025 and 2026?
Sure. Well, let me just at a very high level reaffirm that this has been and continues to be a topic of priority for Governor Mike DeWine. And he has a very, very strong track record on delivering on these areas that he has prioritized for the state. The other thing I would add is that it's really very early for us to be speculating about anything related to certainly the state budget or how federal funding is going to be impacted so early into a new administration. But beyond that, Director Cornyn, anything that you might want to further comment on or add?
I would just add that the suicide prevention plan that we have for years 2024 and 2026 is really designed so that any Ohio organization that is committed to this work can find themselves in that suicide prevention plan. We know that we're not alone at the state level. This really requires every Ohioan to be part of the solution. That includes corporations, nonprofits, county government, all of us really to be rowing in the same direction. And we are very grateful for partnerships with organizations like the Ohio Suicide Prevention Foundation, the Ohio Chamber of Commerce, so many other organizations that are committed to this that may not necessarily receive state funding as well.
Thank you, Director, and thank you, Dr. Vanderhoff. I appreciate it.
You're welcome.
Okay, our next question comes from Shelley Steinmetz, WKYC TV.
Good morning, Dr. Vanderhoff. I just have a quick question regarding the bird flu. Pets, we know pets can contract bird flu. Should pet owners be concerned that they can get bird flu from their pets, or is there any risk of transmission from pets to their owners?
So it's a very, very good question. A couple of things that I would point out. First of all, as I mentioned in my opening comments, it's very important for us as pet owners to remember that we have to use appropriate, good common sense approaches to dealing with our pets, especially when we're cleaning up after our pets, whether that be in the house or outside the house. So again, use good common sense. It's always the right thing to do after we're cleaning up, to, of course, wash our hands very thoroughly and to avoid touching our face, our nose, and our mouth when our hands may not be clean. Okay, so that's just good common sense background. The other thing I remind people is that so far we have simply not seen transmission of H5N1 or highly pathogenic avian influenza from species other than wild birds and some other animals in an agricultural setting. So I do not think at this time we need to be unduly concerned about our house pets unless we're talking about perhaps a backyard flock. If you are dealing with a backyard flock, I do think you need to have a heightened sense of care and caution, recognizing that your backyard flock is vulnerable to avian influenza. It is extremely contagious among birds and for birds that may be exposed to the feces and other materials from wildlife. If you are maintaining a backyard flock, therefore, please keep a very close eye on their health. And if at any time you have concerns about the health of your flock and or have dead birds, please reach out to the Ohio Department of Agriculture to get further guidance and instruction about how you should handle that situation. Also, if you have been handling dead or ill birds, please also consider reaching out to your local health department so that they can guide you regarding symptoms to look for and where to go should you develop symptoms.
Okay, our last question today is from Andrew Harper, WSYX TV.
Hey, quick question. LeeAnne mentioned Ohio lost 1,777 people by suicide last year. I'm assuming she was as in 2024. How many people died by suicide in 2023 for the state? Just so I can compare those numbers.
So a couple of things I'd point out. In terms of the breakdown of information, including demographics, you'll find much of that in the actual report, and I'd ask you to turn there. I don't have immediately at hand, and I will give Director Cornyn a chance to jump in here. She may have information about the year-by-year comparison. Regardless, we can get you that, and I believe it is available through our link. But a couple of very high-level takeaways from some of the charts in the report that I think I would share. One is we saw our rates decline for all racial groups, with the exception of Asian and Pacific Islanders. So we saw some pretty broad improvements in the rates of suicide. And the other takeaway is that while firearms remain the leading mechanism, the number of deaths by suicide from firearms also declined. So again, an encouraging finding. Director Cornyn, anything that you would add?
Today's report that the Department of Health is releasing represents our most up-to-date statewide data for the year of 2023. 2024 data will be collected by the Department of Health, but that would still be preliminary at this point.
So the 1,777 was from 2023 that you mentioned?
That is correct.
That's correct.
Okay, thank you.
Yeah, no, this report is a 2023 report.
Okay, got it.
Okay, thank you for joining us today. And Dr. Vanderhoff, do you have any closing remarks?
Thank you again for being with us here. Thank you for your efforts to share this important information with the people that you're able to reach. And please continue to take the weather very, very seriously and take appropriate steps to keep warm and avoid cold exposure. Thank you.
And this will conclude today's press conference. Thank you.